So how to be a major premium IOL ophthalmic practitioner, that is very important. Myself, Arvind MORYA. So whenever we are looking for any ideal premium IOL, so what needs to be the qualities? So it must be free from the dysphotopsia, free from the halos, glare and the starburst phenomena, and ability to correct distance intermediate as well as near vision with full clarity, and it needs to be cost effective also in if we are looking at the an initiator or the beginner in practice. So counseling is an foremost important part. We need to have very strict SOP regarding the inclusion as well as the exclusion criteria. Type of personality, again very important. Cons and pros, side effects, advantages, and profession. What is the profession of the patient? That is also very important. So answer to all is Make in India, Autofocus Pro, ringless polyfocal progressive posterior chamber intraocular lens. So if you see in the upper part, this is the Autofocus Pro IOL, and the below part we can see the rings are there. So these rings are absolutely not there in the Autofocus Pro. So it looks like monofocal but works like multifocal. So it is an aspheric polyfocal progressive lens. There are no diffractive rings. It is static and fixed in the bag. There is no mechanical pseudo accommodation, no negative dysphotopsia, and no to minimum positive dysphotopsia. So if you see that when the pupil is dilating and with a 6 millimeter of the optic, there is temporal as well as the nasal part that is aphakic, and that is casting shadow on the opposite part of the retina, and that leads to confusion and leads to dysphotopsia. But it has a large optic size. So when we see through the night eye OPD scan, it looks just like any progressive this glasses as I am wearing. So this is a principle behind the Autofocus Pro IOL. Yeah, and this is the design and dimension. So you can see there is a modified L-shaped with outer serrated achromatic zigzag. So the whole 6 millimeter is in firm contact with the capsular fornix, whereas in the other premium IOL modified C-loop, only a tip of that haptic is touching the capsular fornix. That's why it has excellent rotational stability. It is 7.5 horizontal and 6.3 millimeter vertically. So it needs to be dialed horizontally. There are two dialing holes that are position indicator. What is the principle, how it acts, how it is able to correct the distance intermediate and near vision? So it has a patented GRIN technology, gradient refractive index. So in the superior part, the refractive index is 1.42. It gradually increases to 1.54. So that's why it is able to correct all types of vision without any refractive or diffractive rings or without any posterior polarization of the surface. So these are the light distribution. So even when the pupil is myotic of 1 millimeter, so all the three ability to correct distance, intermediate and near vision will always be there. Again a comparison, if we see, so the full visual field is covered by the IOL because of the large oval haptic size, where you can see the aphakic temporal visual field in the other premium IOL with a 6 millimeter of the optic. And let's see, so it comes in both the copolymer form, hydrophobic as well as hydrophilic form, copolymer by Contamac UK, and they are preparing these biomaterial since more than 20 years all over the globe. So this, and also it comes in fully 100% preloaded also. So this is a preloaded hydrophobic IOL, and it has both the options. We can either push it or we can rotate it also. It has both the options. And the beauty is we don't need to push the whole IOL. When we just push the 50%, so under microscope we can see the IOL is perfectly moving. So very gentle injection through a 2.4 millimeter incision, whereas the copolymer, it requires 2.6 millimeter of incision. We just need to push only 50%, rest of it opens on its own and we can manage it. So there is, it is pupillary independent, angle kappa or angle alpha, they are of no significance or importance. There is no light energy loss because there is no destructive interference or diffraction. My mom had this angle of 0.7 millimeter, hyperope 25 diopter. Recently, 4 months back, I implanted, and she doesn't require any glasses for mobile laptop work and also for newspaper reading. So, and now the excellent part is because by 2040, I think 50% of the population will be myope, and then they will undergo for the LASIK surgeries or the keratorefractive procedures. In these patients, there are high chances of refractive surprise. So only this IOL has this much of depth of focus. We have recently concluded a head-to-head trial with this iCryl Biotech. So that IOL has plus minus 0.50 depth of focus. What is depth of focus? It gives that freedom from plus 3.5 to 5 diopter. If our biometry is wrong, still the patient vision will be 6 by 6 with this IOL. Whereas in the iCryl, it was plus minus 0.50 diopter only. So this is the one of the major advantage I really liked about it. And so that's why it is a forgiving IOL. We don't need the fancy these IOL master like that things. Now coming to the contrast sensitivity, again as there are no rings, so it is as equivalent as any monofocal intraocular lens. Reading speed is very good, from 150 to 200 words per minute. That is excellent, and it doesn't require neuroadaptation. It is instantly accepted and adapted to, and it can be implanted in monoocular cataracts also. Previous eye having any monofocal IOL or any other premium IOL, we can implant this IOL. So out of more than means 1.5 lakh implantation all over the globe by 100 surgeons, not a single patient is complaining of negative dysphotopsia. And this we have already discussed. So there is no aphakic area in the mesopic condition when the pupil is fully dilated. So there is no gap because of the 7.5. So there is no negative dysphotopsia. And there were 18 patients complaining of nagging dysphotopsia with the other IOL, no financial interest, nothing against the other IOL, they are very good. So we removed those IOLs and implanted Autofocus Pro IOL, and now the patients are doing very well. And the large lens advantages had its own advantages. Now coming to the crisp and clear quality at the retina, that is the modulation transfer function. So as we opt for monofocality to the bifocality, then we go for the trifocality. So it drops down from 80% to 30%. But with this IOL, it has MTF value of 70%. No other IOL premium IOL has this MTF value. So we need to look for the personality before implanting such kind of IOL. So in short, with more than 1.5 lakh implantation all over the globe, for us in our practice, there is nothing like monofocal, multifocal, trifocal or EDOF. It is universally fit for any eye with fairly good retinal function and clear cornea. So this is the ultimate premium monofocal, and keep using it as Autofocus Pro for all. And the customized toric option is about to, I think within 3 to 6 months, it will be commercially available. So all the other IOLs, nothing against them, they are also good. But the jewel of the crown is of course Autofocus Pro IOL. The cost is only 8,000 plus GST to the surgeon. Thank you so very much.
That is for the hydrophilic. Hydrophobic is 13,000 plus GST. Now few new development, if you don't mind, can I tell?
Yeah, please.
We are changing we might be able to get the customized IOL as per the spherical aberration of the patient. So that probably will improve the quality of vision for distance. We expect that from 6.6 we might be able to go to 6.5 or 6.4 in these lenses. It will take little time. First batch is expected to come on Wednesday to my place. Toric also is there, and in toric also, even if you are putting a rotation not horizontally, either vertically or oblique, the quality of vision for near and distance will not change, but depth of focus might slightly deteriorate because it is not placed horizontally. These are the few things we are expecting in next 2 to 3 months to make this lens better than what it is now.